I'm Dr. Andy Kaufman, recovering physician, plandemic whistleblower, natural healing pedagogue, and legal code talker. You can call me the Truth Doctor. I'm here to shift your paradigm as I perform a radical forensic dissection, discerning fact from fiction, science from pseudoscience, medicine from poison, law from legal fiction, and individualism from collectivism. This is your channel for unraveling the truth about health and science. This is the Healthy Living live stream. Today we have a very important and interesting topic where I'm going to inform you of some key information that is conveniently or perhaps inconveniently misrepresented in mainstream health. So this connection between the liver and the skin is primarily what I'm going to discuss, and this is well known in the mainstream medical community, but it is misreported or misinterpreted, and I'll certainly explain what I mean. So what you'll find if you look this up is that you'll see lots of articles or papers related to the skin manifestations of serious or severe liver disease like cirrhosis, which is at the end stage of liver disease. And there are lots of skin or cutaneous manifestations, and this provides some primary evidence of the connection between the liver and the skin. But here's where the real problem that leads us astray is that we have much less severe and early liver disease. Now, in mainstream medical circles, they refer to this as non-alcoholic fatty liver disease, or NAFLD. But this is very, very difficult to detect. And it's acknowledged by mainstream medical sources that in early stages of liver disease, there are no symptoms. And in addition, the typical blood tests that are used to detect liver disease also will not be affected early on in liver disease. So we have this kind of black hole that it's reported that there are lots of cases of early liver disease or fatty liver disease, but we have no way of detecting or diagnosing this in terms of a screening mechanism in the clinics. So the only time that this is detected is when it's more advanced and it's causing more severe symptoms, or there are abnormalities in the blood tests that prompt the doctors to do further examination. Now, you can detect this on certain imaging studies like ultrasound, but this is simply not done on a routine basis. And also the sensitivity may not be as good as needed to detect these problems. So if we can identify consequences of this early liver disease and symptoms that may not by typical doctors be associated with liver disease, this is what gives us clues that there may be something wrong with the liver, even though if we check the blood tests, they'll be normal. And if we ask about the typical liver disease symptoms, the ones involved in severe liver disease, they have not manifested yet. Now, I find that also in natural healing, if the liver is not fully healthy and functioning properly, that this is going to be a major barrier to the body's ability to properly heal and detoxify. So this is a crucial issue if you want to get healthy. So in today's talk, I'm going to present a little bit of the physiology of the skin and how it relates to the liver. We're going to talk about what the current medical literature shows about this relationship in more subtle or less severe liver disease. And we're going to find some problems in how they report things, but the information that we're seeking is there. So you're going to understand this relationship. And then at the end, I'm going to give you some action steps that you can take to improve your liver's health. So let me bring up the slides, and we'll start with this. And this is commonly known information, but it's not fully integrated into additional research and how we understand certain consequences of this information, which is that the skin expresses the same detoxifying enzymes that we find in the liver. And these are not expressed in too many other places in the body, but they certainly are in the skin. And we're talking about phase 1 and phase 2 pathways. And these are the detoxification pathways in the liver. And phase 1 is often talked about in terms of the cytochrome P450 system, in case anyone is familiar with that. And those are a set of enzymes that carry out what's called biotransformation. So they take a foreign chemical and transform it into something more compatible with the body to get rid of. And pharmaceuticals are well known to often be processed by this pathway and other exogenous chemicals or chemicals coming from outside the body. So one could hypothesize then, since we have a redundancy of these detoxification pathways that is primarily conducted in the liver, in the skin, that the skin may, one, have this in order to metabolize substances that may come in contact with the skin and get absorbed through the skin, but also it may act as a backup system for the liver when the liver's function is compromised. And this is my central hypothesis that I'll present today. Now, interestingly, in this literature, they talk about skin metabolism based on these detoxifying enzymes and suggest that when they study pharmaceuticals, because one of the things that you have to study when you're learning about a pharmaceutical and planning to apply to the FDA to get approval for the drug is how the body metabolizes the drug. This is part of what's known as pharmacokinetics. And they always look at the liver and the kidneys, but they don't look at the skin. So the authors here and authors in other papers are suggesting that we may also need to look at if the skin metabolizes these drugs, primarily for drugs that are geared towards being applied directly to the skin, but perhaps also for drugs that are taken systemically, that the skin metabolism may play an important role. Now, if we go beyond this basic physiology and look at pathology, I found this review article about dermatologic disorders and the liver, and I'll read the highlighted sentence here. Dermatologic manifestations are one of the most common extrahepatic manifestations and often provide the first clues of the underlying liver disease. In other words, before other things are abnormal, you would have skin manifestations. And this goes with what I said earlier about many of these skin conditions being involved early on in the course of liver disease. But not all the ones they mention in this paper fit that. But they do talk about different potential relationships between the liver and the skin, and they list 5 here on this slide. One is the skin manifestations of liver cirrhosis. Now, cirrhosis is the end stage of liver disease when the liver is essentially mostly scarred over and fibrotic. That's what that means. Now, 2, systemic diseases affecting both the liver and the skin. So according to my hypothesis, it may be that the disease affects the liver, but then the skin is the backup system, so it is brought into the equation. Number 3, primary skin disorders affecting the liver. Now, this is one thing that is a little bit tricky, and I haven't seen any clear evidence for, although it's possible if a substance toxic to the skin, toxic to the liver rather, penetrates through the skin, it can affect the liver without any mechanism of normal skin affecting the liver in some way, like they might propose here. And then number 4, dermatologic manifestations of specific liver diseases. And this may just be due to individual expression, but it's interesting to look at. And then lastly, drugs used by dermatologists causing hepatotoxicity. And that is really related possibly to number 3, because it could easily look like the skin disease is affecting the liver when it's actually the treatment for the skin disease that is toxic to the liver. And in clinical situations, usually when you see someone with a skin condition, they've already tried things themselves, either that they had a prescription for another condition lying around the house, or they went to the drugstore and bought over-the-counter products. People generally do that before they go to the doctor. Okay, so we can see this relationship panning out. Now, here is a table from the same paper which lists different diseases affecting both the liver and the skin. And here we have autoimmune diseases like lupus, Sjogren's, and scleroderma. Some consider sarcoidosis and psoriasis autoimmune diseases as well. We have toxic epidermal necrolysis. That is a very severe condition where the skin essentially sloughs off and it's like full thickness burns. Mastocytosis, which is an allergic inflammatory infiltration of the skin, and even skin cancers, which makes sense because if there are carcinogenic substances that cannot be processed and detoxified by the liver, then go to the skin, they can have the carcinogenic effect on the skin cells as well. So we see more and more evidence of this connection in the literature. So let's look now at atopic dermatitis, a very common skin condition. And I've often talked about how atopy, which is the trio of allergic conditions of eczema or atopic dermatitis, asthma, and allergic rhinitis or nasal allergies. Those 3 conditions are called atopy, and I've proposed previously that they have a relationship to the liver, and this is clearly borne out in some of the evidence I'm about to show you. So here we see a study in mice where they had a, quote, animal model of atopic dermatitis, and then they looked at the liver through a biopsy and by assessing the quantity of lipids in the liver. And I'll just read from the highlighted portions here because the model that they used, they administered picryl chloride to the mice to, quote, induce allergy. Now, I'll get back to picryl chloride in just a minute, but here's what they found is that triacylglycerol accumulation, that is a fat, was promoted in the liver in the mouse atopic dermatitis model. And these results suggest that atopic dermatitis causes lipid accumulation in the liver. Now, there definitely was an association because they gave these mice picryl chloride, and they manifested both fatty infiltration of the liver and eczema. Now, interestingly, the authors never considered the reverse causality that it may have been the liver insult that led to the skin condition, because they had predetermined in their hypothesis that it was the eczema was going to cause the liver problem. But this came through ignorance because I was unfamiliar with picryl chloride, but looked it up on PubChem, as you can see here, and it induced liver allergy in this toxicology study and in these 2 toxicology studies, that liver injury was induced by picryl chloride. And they also talk about allergic manifestations, but here we have another way to interpret the findings, that picryl chloride is toxic to the liver, causing fatty infiltration. And as a result of that, toxins get sent to the skin as the liver's backup and manifest as a skin condition like eczema. Now, this seems really quite clear when you look at the details. I don't know why the authors didn't know about the liver toxicity of picryl chloride. Now, we can also look here to the epidemiologic data, and this is a study from Korea, which looked at over 160,000 subjects, and it was comparing the incidence of asthma to their fatty liver index. And in the highlighted portion, it states the cumulative incidence of asthma was higher in subjects with higher versus lower fatty liver indices. So if their liver was worse off, they were more likely to have asthma, which, as I stated previously, is closely related to eczema. Now, I wanted to investigate possible mechanisms in here, and I found that there was a relationship reported in the literature between the liver and histamine. And we know that histamine is a mediator of the allergic response, including asthma and eczema. And it turns out that this has been reported in the literature that there's a close relationship between histamine and histamine receptors and non-alcoholic fatty liver disease. And I was able to find some older papers from the 1950s which discussed that the liver actually reduces histamine. So this would make sense that if the liver was compromised, it would not be able to reduce the histamine levels that were circulating. Thus, there would be more histamine, and that would mediate some type of allergic response. And one can think about this quite simply as if the liver is compromised, it doesn't have the ability to process the toxins, which both are endogenous and exogenous. So the skin starts to act as the backup system, and this may be mediated partially by the levels of histamine. So we can see, if we read carefully and think clearly about what's reported in the literature, there is a strong association between skin diseases or manifestations of disease in the skin, as well as the pathological state of the liver. We know that the skin cells contain the same detoxification enzymes, both phase 1 and phase 2, and in cultures has been shown to actually metabolize substances using those enzymes. And then lastly, we have this connection between skin conditions and allergic conditions and the liver, and some experimental evidence to support that. Now, in my own reasoning here, I actually came to this information initially from other natural healing sources, but then through observing people doing natural healing, including myself, that I was able to see improvement in these conditions by working on the liver. For example, when I first tried a coffee enema protocol, I was able to resolve my food allergies that had been present for 25 or more years. And also some things on my skin did clear up, and many, many other people have had this type of result. So to then examine what's available in the scientific literature and see the same kind of connections and some obvious underlying mechanisms present, it really helps to validate this approach. So if you are suffering from a skin condition or allergies or asthma, and the skin conditions can be many. So commonly we talked about eczema, but there's also a very strong relationship with seborrheic dermatitis, with psoriasis, with rosacea, with skin manifestations of so-called autoimmune diseases like lupus and scleroderma, and many other conditions. So if you are dealing with virtually any skin condition, most likely it is rooted in problems with your liver, and addressing your liver is going to provide a substantial benefit. So let me give you some tips on how you can do that, and there are different levels. And I think the most important thing is to stop exposing yourself to substances that are harmful to the liver. So these can come from many sources, and I'm going to talk about food separately, but let me give you a couple of categories. So a variety of occupational exposures, anything where you use a lot of chemicals, there's a possibility of liver toxicity, and there are many chemical solvents, for example, which are used in all kinds of applications. Obviously, pesticides and herbicides and other things that are supposed to be poison to kill other things are certainly suspect. Now, there are also many, many pharmaceuticals that contribute and cause this problem, and some of the biggest and most commonly used offenders include metformin, which is often used for diabetes and metabolic disease, statins, which are toxic by multiple mechanisms, and they lower cholesterol, many different antibiotics, although not every single one, other diabetes drugs like sulfonylureas, many chemotherapeutic agents, immunosuppressive drugs, and psychiatric medications are among the worst offenders. Then, of course, we have heavy metals, which are toxic to different organ systems, but may have effects on the liver as well. And these can be contained in vaccines, aluminum cookware, and food storage, like aluminum foil. And especially if you cook with it, some of the aluminum will get into your food. Baking powder, but although you can find aluminum-free baking powder, antiperspirants, tobacco products, which often contain cadmium, and drinking water. So the next category is cosmetics and oral hygiene products. So anything that includes BHA and BHT, which are preservatives, formaldehyde, and phthalates have liver toxicity, and plastics, especially food containers and clothing, because those provide mechanisms for the plasticizing chemicals like phthalates to get to the inside of your body. So you want to minimize or eliminate your exposure to those classes of substances. And then I'm going to talk about food here. So the foods that are harmful for the liver are half of the equation, and then also providing the proper nutrients for your liver to optimize its functioning. So the harmful foods to the liver, of course, are what we already know about. That is going to be sugar, processed carbohydrates like bread, crackers, pasta, etc., pasteurized dairy, various processed foods that have ingredients that are liver toxicative, such as GMO, trans fats, MSG, food coloring, emulsifying agents, preservatives, anti-caking agents. And another big offender is seed oils. We definitely want to stay away from those. Artificial sweeteners, alcohol, I think we already know about. Many juices, energy drinks, and teas may have compounds in them that are toxic to the liver. And there are some legumes and tree nuts which tend to accumulate aflatoxin during storage. And these include peanuts, pistachios, and corn. And aflatoxin is a very bad liver toxin and may even lead to liver cancer. So you definitely want to minimize and avoid those. I have read that Spanish peanuts do not grow the type of fungus that causes aflatoxin accumulation. So you can look into that further, and perhaps there are some commercial preparations using Spanish peanuts. So what about the foods that are good for your liver? Well, there are a number of vitamins that support liver function, and these can be found in a wide variety of foods. Also, it's critical that you have certain amino acids, especially sulfur-containing amino acids like cysteine and methionine, and as well as glycine to make collagen, and branch-chain amino acids. Now, many of these amino acids are very difficult to find in plant foods. So if you are vegan, you have to work really hard to get the right nutrients, but in meats, you're going to find much more of these nutrients. Now, also, various minerals are extremely important, and I always recommend that everyone take some form of trace mineral supplement, which is why I sell Shilajit, which in my opinion is the most natural and best source of trace minerals. Okay, so after covering those elements of minimizing your exposure as well as dietary factors, I just want to mention a couple of other things that are important to address your liver's health. So one is that there are certain herbs that really support the liver's function and healing. And the most potent and strongest one that I always use successfully and teach about is, of course, milk thistle. So milk thistle is an integral part of anyone who is trying to improve their liver health. Now, in addition to that, there are certain procedures that you can carry out, and there are really two main types of procedures out there that you'll see. One is called liver flushes, and the other is coffee enemas. Now, I'll just briefly explain them. Liver flushes entail essentially a 24-hour process where you load up on Epsom salts, which is a laxative, and then in the evening, you take a mixture of generally olive oil with some kind of citrus juice, which could be lemon juice or grapefruit juice, depending on which protocol you're following. And it may include other elements, like if you look at Jennifer Daniels' liver flush protocol. And you take that in the evening, then you do your best to sleep. You wake up and you either have a huge bowel movement or you take more Epsom salt and then have a huge bowel movement. And you'll find that all of these stones come out because there is an emulsification and precipitation that occurs that causes the basically toxins in the bile salts, that the sludge and stones that are in your liver, to come out and be expelled through your colon through this process. Now, this type of procedure is something that you do once and then you repeat again in 3 to 4 weeks, and you can repeat it until you have adequate results. And the other procedure is coffee enemas. Now, this is most famously developed and protocolized by Dr. Gerson of the Gerson Institute. And if you're going to carry out coffee enemas, a subject I have talked about extensively in the past, I suggest that you follow Dr. Gerson's protocol. But how this works is that you use coffee in the enema instead of water, and you hold it in the rectum and colon for 12 to 15 minutes. And during that time, through the portal circulation, which is a special blood circulation system of the digestive tract, the chemicals in the coffee will go directly to the liver, where they have the effect of dilating the bile ducts and allowing the sludge and stones to flow out of the liver. And there are some other hypothesized mechanisms in that process as well. But this is different, that you don't do one coffee enema and then wait 3 to 4 weeks to do another one. You would do usually 2 or more on a daily basis for a period of time. Or if you are just maintaining your liver health, you may do 1 to 2 coffee enemas, on 1 day a week. And there are several people I know who maintain that kind of a regimen and have very good results. So today I've told you a lot of information about the liver-skin connection, as well as some steps that you can take to improve your liver's health and reverse some of these skin and allergy conditions. All right, so now I have a few minutes perhaps to take a couple of questions. Alexander, thank you. All right, Gabby Munoz asks, are you familiar with Grant Genero and Garrett Smith's view that too much vitamin A is behind so many autoimmune and chronic conditions, including eczema? Any thoughts? I have heard this before several times, but I haven't examined it in detail or found any clear scientific evidence, although there may be some out there. But I would just say that vitamin A is this topic that is often confused because people equate beta carotene with vitamin A, and they are different because vitamin A is only made in animals, not in plants, talking about retinoic acid. The only thing I can say about this is that individuals who eat a lot of foods that are rich in vitamin A, not necessarily beta carotene, tend to have excellent health. And this would be exemplified by many people in the carnivore space who have been eating that way for extended periods of time and get pretty high amounts of vitamin A in their diet. So, like I said, I need to look into the details, but that evidence would certainly present something that would have to be explained otherwise in this research. All right, KR says, hi, Dr. Andy. Hello, KR. I have a question regarding chronic acne in a teenager. While hormonal changes can cause occasional acne, well, I would beg to differ about that. What does it mean, and how can you resolve facial acne that has persisted for a few years and progressively worsened? I've tried elimination diets and maintained a fairly clean diet. Thank you, and here's to healing from the inside out. Well, many times the devil is in the details, and I would have to know what an elimination diet was and how long it lasted. But in my opinion, acne is another example of the skin detoxing, because we actually have material that is coming out of the skin, right, through the various acne lesions. So that seems pretty clear. Now, why does this happen, during teen years? And I think this is a consequence of specific developmental events that result in this toxic expression. But I don't think you would have acne unless the body had toxins it was getting rid of. In other words, the hormones itself don't cause it. They just open up a pathway. The true cause is the presence of these toxins, which the body needs to get rid of. And I would love to see a study done where they actually took the pus or the exudate from acne lesions and tested them for various chemical toxins, because when they've done this with many other types of bodily fluids, like even menstrual fluid, they have found strong evidence of lots of toxins coming out in those materials. Now, in teenagers, and this is something I've definitely given some thought of too, because I have two teenagers myself that have some of these issues, that I kind of see this pattern that when children transition into puberty, they often have one of three issues if they have a lot of toxins in their body. One is that they accumulate abdominal fat, and this can even start before puberty, but often it's accelerated at that time. Two, once menarche begins, then when girls have their first period, they may have very difficult, painful, and prolonged periods, because that is the way that they're getting rid of these toxins. And then acne is the other pathway. And of course, any individual can be afflicted with more than one of these pathways, depending on their toxic burden and what the patterns that have developed in their body. And I see these things as pretty similar. So really the way to deal with it is to, of course, clean up the lifestyle the same way that I talked about in the lecture with respect to the liver, and then to, engage in some kind of detoxification protocol. So if you're just doing an elimination diet, provided it's a very good elimination diet that really does eliminate anything that could cause problems with the liver, then you might have to do it for 30 to 60 or even 90 days to get full resolution. And if you're kind of clean, that's going to subvert the whole approach. What I found is that if you start off a protocol with a very clean diet, you have to keep it extremely clean until the problem is fully healed. If you abandon that and start introducing other things like cheating in various ways, then you're going to be right back where you started in the beginning. And then you'll think that you didn't make any progress when you actually did. You just subverted it. So it's important to keep that lifestyle going. And I would say, for a teenager with acne, to be on an elimination diet probably for 90 days. So it's got to be one that provides full nutrition that will not get in the way of normal growth and development. And a carnivore elimination diet like the BBB and E diet, that you can find out more on my interview with Dr. Ken Berry would be an excellent choice, but you got to stay strict to it and stay on it. So no slip-ups whatsoever. All right, I think we can do one or two more questions. Carrie Stratton asks, also, do regular enemas weaken intestinal muscles? I have never seen any evidence of that, nor does it really make sense, because when you do an enema, you still are going to push it out by peristalsis. It seems to stimulate the peristaltic contractions of the colon, which is why it's sometimes difficult to hold the enema in, like with coffee enemas. So I do not think this is an issue whatsoever. All right, Duke W asks, what non-surgical treatments do you suggest to reduce size and discomfort from a 3-centimeter epidermal cyst on the left upper side adjacent to the left breast just above the mid-axillary line? Well, this is perhaps slightly outside, although if this is not due to some injury or local effect of that area, it will most likely have a liver component. So taking the same measures I talked about to improve the liver's health will be certainly necessary. However, also with skin lesions, we can use a variety of substances, and what I find to be most effective are healing solvents directly on the lesion. And provided our liver is capable of processing whatever comes out of that lesion, so in other words, we have to have good liver health to begin with, the solvent can help dissolve the toxins in the skin lesion, put them in the blood, and deliver them to the liver, where they can be processed and then excreted through the bowel. So something like castor oil, for example, can be excellent at achieving this type of thing. You might also consider essential oils, which can be mixed with castor oil, as well as DMSO and turpentine. All right, do we have one more question? All right, this will be the last one from Julie H. Hi, Dr. Andy. Hi, Julia. Is eliminating wheat from the diet absolutely necessary if it is organic? Is it the wheat, or is it the glyphosate, or in general, is it safest to eliminate all grains? Cheers. Well, in my opinion, grains aren't really good food because you can't go and pick them right off the plant and eat them. You won't be able to digest them. They have to be processed in some way in order for us to absorb any nutrition from them. And any elimination diet that I would recommend generally would be grain-free, or certainly it would be, gluten-containing grain-free. So organic may or may not be enough. In my experience, what I've actually found is that people who eat wheat in Europe, like having pasta in Italy, do not have the same problems that they do eating wheat-based products in North America. And I think this may even be true with organic products. So I would recommend to, yes, go completely grain-free. I don't eat grains at all unless it is a cheat occasion of some kind, personally. All right. Well, thank you once again for excellent and stimulating questions. And I hope today's presentation was valuable to you and your health. If you would like to learn more about the liver and how to improve your liver's health, please do check out my terrain workshop called Love Your Liver. The images that I showed earlier were from the documents and protocols that are included in that workshop. So if you want to get more comprehensive information and a protocol on how to address your liver and skin health, please check it out on my website. All right, everyone, I look forward to seeing you next week for another Healthy Living live stream.